Hi everyone. So today we're going to be going over hand, foot, and mouth disease. So what is hand, foot, and mouth disease? It is a contagious viral infection. It's caused by strains of Coxsackie viruses and enteroviruses. The most common ones are Coxsackie virus A16 and enterovirus A71. And then Coxsackie virus A6 has recently emerged as one of the more dominant cases in the US. Coxsackie virus A10 has been implicated in more severe cases, so it should be especially looked out for. Symptoms typically include a low-grade fever, reduced appetite. The most common is mouth or throat pain, and the most distinguishing symptoms are the lesions that come up on the hand, feet, legs, arms, mouth area, or the genital region. Who is most susceptible? So it most commonly affects infants and children. There was actually a surveillance study from outbreaks in China that showed that 90% of cases were children 5 or under. It can also affect people who are immunocompromised. That is not to say that it won't affect individuals with intact immune systems, but they're definitely less susceptible. So transmission, hand, foot, and mouth disease is typically spread through vesical fluid or oral secretions. So if somebody with the virus coughs, sneezes, or talks close to someone else, they have the potential of transmitting it. Same for kissing, hugging, or sharing cups and utensils. And it can actually be transmitted through feces as well, or touching surfaces that others have touched. Because children are more susceptible, it's typically has more rapid transmission in daycares, summer camps, or in the family unit. There was a study that showed a positive correlation between an increase in environmental temperature and incidence of hand, foot, and mouth disease. So due to that, it's more prevalent in the late spring and early summer seasons. The incubation period ranges from 3 to 6 days, so that's typically when more rapid transmission occurs. Diagnosis and treatment. So it is typically diagnosed through a polymerase chain reaction assay, so PMR testing, and that is a more resource-friendly way of testing, and it's the fastest way to test as well. Treatment options are typically just supportive care that may include NSAIDs, acetaminophen, and hydration. And then other than that, it is just waiting, so time. Symptoms usually resolve on their own in 7 to 10 days. They're actually looking at some vaccine candidates for it. Many have developed in China and are being used, and there are some others in the making. Prevention. So the best way to prevent hand, foot, and mouth disease is using proper hand washing techniques and consistently washing your hands. Because it can be transmitted through feces, it's also important to teach your children to wash their hands as well. And community intervention studies have showed that there has been an improvement with proper hand washing techniques. And then potential effects. So while hand, foot, and mouth disease is typically a more relatively mild disease, there are some circumstances where more severe effects are seen. This is mostly with enterovirus cases, so that should especially be on the lookout. They have the potential of involving the central nervous system, which then can cause things like encephalitis, like inflammation of the brain, or Guillain-Barré syndrome, polio-like symptoms, all the ones listed on here. Other considerations. So there should be some special considerations given the overlapping symptoms with other infectious conditions. So similar cases like herpes simplex virus. So we want to make sure that we're doing proper diagnostic methods for these. Resource management. So individuals are typically treated as outpatients due to the more mild severity, but there are some exceptions if it involves the central nervous system. And infants tend to develop dehydration, so they may require intravenous hydration. And these are my references. And if you have any questions or comments, please put them in the comment section. Thank you, everyone.